how to ask a client to rebook with integrity and with confidence. So the way that that works is when we are rescheduling a client, first we have to understand why, right? So I know that there's some standards out there that I might be conflicting with when I say this, but I truly believe this, is that there are some standards out there that are just like, oh, come back, once a week for a regular massage or every 2 weeks. I cannot make that recommendation unless I have some evidence and understanding of why I'm making it. So what that means is I need to understand what the client's goals are, what's happening with their body, and if I feel like I'm the best fit for helping them improve that and achieve those goals. So when you're done with your massage session, maybe it's the first time you've seen this client, there's a big difference between somebody coming in and they're like, I just want to relax and just give me, it's a special, it's my birthday. And so maybe you work with them and they just relax, they have a nice session and they leave. To me, it doesn't feel like integrity to be like, okay, did you want to come back next week? Because in their goals of their session, they weren't looking for this big thing. They were coming in for a birthday, right? So that's not something that I'm going to recommend they come back all the time for. But you can ask like, hey, like, how often do you get massages to relax and pamper yourself? And, they might say like once a year or, every couple of months. Based off of what they say, like then you can kind of make a recommendation that's in alignment with that. And you go, oh, well, you've been coming in every couple months. Did you want to try and schedule for that so that it's on your calendar and you make sure that it happens? Or would it be okay if I reached out to you and just checked in to see how you're feeling? So that's a way to actually create a relationship with a client who may not be super regular, and you're making that recommendation with integrity with their best interest, not come back and see me all the time. And then there might be the client that comes in and they're in pain and they're really trying to get out of pain, and maybe you've assessed and they've got a bunch of different dysfunctions going on in their body, and we're not, Rome wasn't built in a day. And most pain and dysfunction didn't happen overnight, right? So when people have bad posture, bad movement patterns, chronic tension, things like that, that compounds over time. So one session isn't going to fix that, and it's unfair to think that you can change that in one session. And also, it's helpful to explain to the client that that's not possible. You can create improvement, but there's a process to like undo the doing. It took time to put on 100 pounds. It's going to take time to take it off. So when I make those recommendations, I'm coming from a place of they're in pain, they want to get out of pain, like that's their goal. And so when I make that recommendation, I'm not coming from like a generic place. It's, as we got in there, we discovered that these other muscles were tight and that this was also part of the problem. And we made some progress on this today. But typically due to muscle memory, because this has been tight for so long, it's going to tighten back up, probably around day 3 or 4. So I recommend that you come back in at least a week. You can come back at day 4, and we can build on that, but a week should be just fine as well. You'll have maintained enough of the progress that we made. And if you do these stretches that I show you, that will also help. And then instead of thinking like, oh, it's, some of the blocks that massage therapists and other healers have is that, oh, it's expensive to come in that often and I want to save them from this. But they didn't ask you anything about the finances when they came in. They went online, they were proactive, and they took action to book an appointment to feel better. They communicated that they want to feel better and that there's pain in their body. So listen to what's going on. They're coming in, they're seeking help, they're looking for guidance, they want to feel better. And if you know that you can help them, then it's your job to actually, it's more full of integrity to recommend that they come back and get this work done so they can actually get the relief they're looking for. And it's less in integrity to be like, well, when would you like to come back? Because at this point, you're more of the expert in their well-being. You have a much better understanding of how the body heals, how it responds to treatment, and how to get them the best benefit. So when you just go, well, when do you want to come back? They're not the expert in this. They are seeking guidance from someone who knows how to help them. So it's your responsibility if you know that you can, to make the appropriate recommendation for their rescheduling based off of all the reasons I said. So operating with integrity comes from knowing why you're making the recommendation, being competent in those reasons, confident, clearly communicating them, and then allowing the client to make the decision. So if I make this recommendation that they should come in next week, and they pause and they're silent, like thinking about it, then I'm going to stay quiet because this is their opportunity to like weigh out all the information I just gave them. They just had a session, so they felt the things I'm talking about. I explained it to them. I explained the treatment plan that I think is going to be best to help them and why they should come back. And now it's their time to kind of prioritize. So if you're feeling insecure, like, oh no, maybe I pushed it, wouldn't you like the opportunity to like really think about, am I going to make this commitment to my self-care? Am I going to make this financial commitment and this time commitment to my body and my well-being? Because depending on what you charge for your sessions, people might have to budget for that. They might have to sacrifice other things in their life. But the truth is, that's their decision and it's not yours. And so acting with integrity is taking your brain out of their pocketbook and allowing them to prioritize their care. And personally, I have found if someone does need some financial assistance to get the benefit that they're looking for, they'll ask, right? So sometimes it's a priority thing and sometimes it is a financial thing. And in my personal experience, they'll talk about the financial thing. And if you can make a recommendation for another therapist that's more affordable, or if you sell packages, there's ways to work with people. And then also making the recommendations for self-care so that they can make improvement on their own time, teaching them self-massage, teaching them stretching, giving them the tools that they need so that they can get improvement without you, and that the improvement they're going to get with you will last longer and build. So that's what I feel is really important in integrity. We really stress this to our clients, our students, so that they use this when they're working with their clinic clients, and they learn how to do this with their clients in real life when they graduate and are in practice. So I hope this was helpful.